What are the best sciatic relief tips? Are you looking for help with your sciatica pain? Probably watched a ton of videos at this point trying to figure out what are the tried and true tips that are going to help you feel better right now. Well, then today's video is for you. We're going to be talking about the best tips that are proven to help relieve your sciatica symptoms, including some exercises that you can do that we'll be discussing at the end. Ready? Here we go. First, tip number one, I want you to ice, and please do not heat. All right, hear me out. I know this is controversial. Ice is one of the top pain inhibitory techniques we have in our arsenal and in our freezer, which means it decreases the pain. So if you're thinking about having to take some medication, but you're just looking for something for pain relief, ice is going to be your best bet. Now, if you really don't like ice, you may be like, I can't tolerate ice for a long period of time. I just need you to ice for 3 to 5 minutes. That's what the research shows leads to the best pain inhibitory benefits, which means it will decrease your pain. 3 to 5 minutes of ice. Now, if it really bothers you to have ice on you, like it causes tension in your neck and shoulders or something like that, I'm going to ask you either snuggle up in a blanket or put a hot pack close to your core, like maybe your abs, to help decrease your body's response to the ice. But I guarantee you putting ice on it for 3 to 5 minutes is going to help you feel much better. Now, where do you put the ice? It depends on where the pain is. I tell my patients, use the ice to chase the pain. So if you have pain in your low back, start there. If you have pain in your hip, start there. If you have pain down your leg, move it down there. 3 to 5 minutes in each location, and feel free to chase the pain. If it's gonna help, why not do it? Ice helps to decrease the inflammation around that nerve, which is gonna help it heal faster, as well as decreasing the pain, which is why I don't like to use heat, because if you're using heat, you're increasing blood flow, but chances are that that's an area that's very stagnant, right? The blood is not flowing well in that area because of all this inflammation. So you increase the blood flow to it, what happens? Well, you have more blood flow, but you're going to have more inflammation, and it's not getting cleared out by your body. So I want you to avoid heat. And if you don't believe me on this one, I'm going to ask you to try it for 7 days. Try icing instead of heat for 7 days, and drop a comment below and let me know how that works for you. Now, as I mentioned, one of the primary issues with sciatica is that the blood flow doesn't move through that area. So you get this inflammation around this nerve. That's the sciatica, is the inflammation around the nerve, and your body can't move it out. And of course, it hurts to do any movement, so you're lying down or you're sitting or you're kind of stuck in one position. Now we're going to go over some exercises that I specifically recommend people do with sciatica, but one of the things I want to make sure that you are doing is moving regularly within your tolerance. I understand that you probably can't go for a run or even a walk or a bike ride right now, but I want you to be moving as much as you can tolerate. Now, if that's taking one trip around your kitchen island every hour, that's fine. It's still movement. It will help to get the blood flowing and decrease that stagnation in that area. It'll help to move everything out so that inflammation will be able to get out of that area. And again, we're going to have more specific exercises at the end of this video, so watch till the end. Next tip for helping with sciatica is I need you to stop stretching. I know that it is super popular to research sciatic stretch videos, and many people have lots of theories on what they can do. Here's what I want to tell you. The sciatic nerve and every nerve in your body does not like being stretched. It gets angry when it's stretched. Now, it may feel better in the short term, but it's not going to help you in the long term. So I need you to avoid stretching the sciatic nerve for right now. If you need something to do to take pressure off of it, we do have this video here where I talk about good stretches for the sciatic nerve, but I'm also going to show you some exercises that you can do at home right now to help get that blood flowing, decrease that stagnation, and take some pressure off that sciatic nerve. Ready? Here we go. Now, for the sake of this video, we're going to say that I have sciatica in my left leg right now. So we're going to start doing this exercise going towards that left side. Before we start, I want to say a word of caution. We only do one side at a time. Don't try to go from side to side with this exercise. It is very important. Tip number 2 that's super important with this exercise is you need to just do a small movement. We don't want to make this a big movement and put too much stress on the discs or the muscles of the low back. So what you're going to do is your feet and your knees are going to be together. Your knees are bent up, feet are on the floor, the table, whatever you're laying on. You can even do this one in bed if your bed's pretty firm. If it's kind of a soft, squishy bed, I don't recommend that because that can make things a little bit harder. But a firm surface where you feel comfortable and safe. What you're going to do is bring your knees to the side just until the right hip, in this case, starts to come up from the table. Then you're going to use the abdominals, these muscles in the front here, to push that hip back down, which brings the knees back. You're going to bring the knees down, hip down, knees down, hip down, knees down, hip down. Now you may say, how is this going to help with my sciatica? Well, what we know from the research is that when you contract your abdominals, it also contracts the little muscles in your lumbar spine. They're called the lumbar multifidi. These guys are the guide wires, so they help to control the joint motion, which is important because your joint motion is really messed up if your disc is herniated or ruptured. So this will help get some muscles so that you're able to coordinate the movement and decrease the stress to the disc. Now, as I mentioned, it's very small motion. As soon as that hip starts to come off from the table, you're going to use your abs to push it back down. It's not going all the way over here. This puts a lot of torque through the low back. I've seen videos on YouTube that recommend it. Please don't do that. That's too much stress on a disc that's already damaged. It is not going to lead to good results. The other thing I've seen all over YouTube is that people will do this from side to side, like a TikTok pattern. Again, please don't do that. You're not going to get the abdominal activation you need in order to activate those multifidi. And again, we want to activate those multifidi because they help to control joint motion. It's very, very important that you do one side at a time. I do 20 reps to the one side, and then I'll do 20 reps to the other side. But I always start going towards the side of the sciatica. It's a little easier to get your body on task when you're doing it to the pain-free side initially. But that means that your knees are moving towards the painful side so that your hip is on the pain-free side. Got it? Go towards the painful side so hip on the pain-free side is working. So you're going to do 20 reps to one side and then 20 reps to the other side. Then we'll move on to the next exercise. Our second exercise, we need to get our glutes activated. The glutes are super important to help take pressure off that low back. And often, especially when you're having sciatica, those glutes have stopped working as well as they should. Now, what we're going to do is you're going to bring your feet a little bit further apart than they were for the other exercise, but knees are still bent up. This should feel comfortable how far apart your knees are. If you feel like they're too far apart and you're unstable, bring them a little bit closer together, but usually hip width apart is okay. Now what you're going to do is you're going to squeeze your cheeks together and you're going to squeeze your abdominals in, and then you can do a gentle little butt lift. Now you don't have to go very far because really what we're trying to do is just get that squeeze. Okay, squeeze the glutes, squeeze the abs, gentle lift. Now some people ask, can I lift further? Now you can, as long as you're not using your hamstrings. All right, sometimes when people are trying to bridge, they squeeze their glutes, they squeeze their abs, they lift up, and then when they're lifting up, they're getting a lot of work or a Charlie horse in that hamstring, and it starts to be painful. If you notice that you're getting that Charlie horse in the hamstring when you lift up, then just don't lift up, because this isn't a hamstring exercise, this is a glute exercise. So really, it's just a matter of getting the glutes activated, the abdominals activated, and a little baby lift. That's really the goal of what you're going for. That's really going to help activate those glutes and get them working better. All of these tips for 1 week and your symptoms should definitely be decreased. It won't necessarily eliminate your sciatic symptoms, but you should notice a significant difference. Maybe you're able to walk further. Maybe you're able to get on the elliptical. Maybe you're able to get moving a little bit more. And again, movement is life. So the more you're able to move, the more this area is going to be able to clear out and the better you're going to be feeling. Now, are you wondering if this sciatica can actually heal on its own, or if you need to go see a doctor, or what the best next steps are for you? Then I encourage you to watch our next video where we are going to discuss if sciatica can actually go away on its own. If you found this video helpful, I would love for you to click the subscribe button. Have a great day, everyone.